Hello and good morning. This is part 2 of the important numbers videos, and all these numbers are extracted from the TOG articles, and this is all to help with your MRCOG part 2 revision. So stick tuned. If you like this video, then give it a thumbs up and also subscribe to my channel if you haven't already, and leave a comment if you found this video useful, and also if you'd like to see some similar videos. So diabetic retinopathy in pregnancy, there's 10 to 20% have mild progression, 54.8% have significant progression of diabetic retinopathy in pregnancy. Between 6 and 8 in 100 pregnancies will experience some form of trauma. Obstetric complications of trauma to the mother include placental abruption, uterine rupture, disseminated intravascular coagulation, hemorrhage, hysterectomy, preterm labor, post-traumatic stress disorder. Possible complications of trauma to the fetus include preterm birth, hypoxic brain injury, and death. Radiation exposure to the fetus, so there is different modalities in how much radiation is the baby exposed to. So radiation dose is measured in units of Gray, GY, and milligray, which is mgy. So cervical spine X-ray, AP, so that's anterior, posterior, and lateral views have less than 0.001 milligray, so quite small amount of radiation, and that makes sense because it's further away from the uterus. Chest X-ray, 2 views, is less than or equal to 0.01 milligrays, so it's more than cervical spine X-ray. Abdominal X-ray is 0.123 milligrays. Pelvic CT scan is 10 to 50 milligrays. VQ scan is less than 5 milligrays. So postcoital bleeding affects 1 in 10 women. Causes are obviously the most important is cervical cancer, cervical endometriosis, genital ulcers, bleeding disorders, sexually transmitted infections, vulvovaginitis, benign vascular tumors, genital warts, trauma, sexual abuse, foreign body, polyps, cervicitis, genital piercings, female genital mutilation, and pre-pregnancy related changes. So the levonorgestrel containing intrauterine system comes in all these different forms. So you've got the Mirena, the Jadis, the Kylena, and the Levocert. So Mirena is 52 milligrams of levonorgestrel. It's licensed for 5 years for heavy menstrual bleeding and contraception. Jadis is 13.5 milligrams of levonorgestrel, licensed for 3 years for contraception. Kylena is 19.5 milligrams of levonorgestrel, licensed for 5 years of contraception. Levocert is 52 milligrams of levonorgestrel, licensed for 5 years for heavy menstrual bleeding and 6 years for contraception. The copper intrauterine devices comes in all these different forms. You've got the copper T380A, TT380 Slimline, T-Safe 380A, QL Nova T380, branded copper arms, copper stem. So that's the part. That's how this is all made. All the 3 top ones. Gynifix is frameless. RUB, another of the intrauterine ball, is another form of giving copper as an intrauterine device. So intrauterine contraception in the UK, there's 9% use of it. Uterine perforation can happen whilst it's insertion, and that's the risk is 2 in 1,000. Risk of expulsion is 1 in 20, and is most common in the first 3 months after insertion. Small number of people can have bradycardia, which is 1.8%, and hypotension, which is 2.1% at insertion. Risk of pelvic inflammatory disease, that's PID, is 1.6 in 1,000. So, sickle cell in pregnancy complications include anemia, fetal growth restriction, preterm birth, stillbirth, miscarriages, painful crises, renal insufficiency, acute chest syndrome, and postpartum infections. Well, that's it. Thank you so much for watching. I hope you found these short videos very useful. They're all just very important points that have been summarized in these short videos, and I will continue to make more of these if you find these useful. So please don't forget to give this video a thumbs up and subscribe to the channel if you haven't already. Also share it with your friends and colleagues, and leave a comment if there's anything in specific you'd like me to go through before your MRCOG Part 2 exams. Good luck revising.